Welcome. This is a part of our Citation Free Tennessee campaign with our internal marketing group, Marcom, here at Qsource, eliminating deficiencies and fines and how Qsource can help you on your survey journey. So just a little bit of background about our long-term care team here in Tennessee. Again, my name is Amanda Odom. I have been in long-term care now for almost 20 years, hard to believe, in various roles throughout my career. I began as a RN supervisor on weekends and slowly worked my way up to director of nursing. As you can tell by the initials behind my name, I am RAC certified. I have worked in MDSs. MDSs is one of my passions. I'm very thankful for working as an MDS coordinator because it helped build on understanding quality measures as far as what I was responsible for as a director of nursing and breaking those down to also improve quality of care, quality of life for the residents that we serve. I'm also a certified professional in healthcare quality. That's something that I obtained here in at Qsource. And again, that just helps focuses many different healthcare assets with promoting quality of care and quality of life of the populations that they serve. Lindsay, would you like to introduce yourself?
Yes, I would. Hello, everyone. My name is Lindsay Bugg. I've been a nurse for over 11 years, spending 6 of those years in LTC surveying in Kansas and in Texas, basically empowering facilities with the knowledge needed to improve their quality of care, educating on CMS guidelines and how to make sure they're always survey ready. I was one of those surveyors that wanted to help. So creating that positive surveying culture, because we really are a team. And here at Qsource, that's exactly what we do. Kim?
Hi, I'm Kim Snyder. Have a little more years under my belt, over 35 years as an RN. And 20 of those years, I have been a licensed nursing home administrator in North Carolina and Florida. I also have a background in healthcare risk management. And I've also surveyed like Lindsay has, but I did come to the other side again. So, this has obviously been my passion for many years. So welcome to the webinar.
Thank you, ladies. As you can tell, our team has a vast experience in healthcare compliance consulting. We have worked with many facilities, not just in the state of Tennessee. We are national. This year alone, we've worked in other states such as California and Louisiana on facilities, survey journeys, and compliance. So what about Qsource? So we have stayed true for almost over 50 years, almost 51, to improve healthcare quality through patient-centered, provider-focused solutions. And what that means is that when you come to us and you have an issue and you have a concern, is that we are going to focus directly on you as an individual. And those solutions will be tailored to improve your residents' quality of life and your facility's quality of life. Again, we've been operating for over 50 years as a nationwide leader in quality improvement and quality assurance. And we do this across many healthcare settings. We don't just do this across long-term care. We also do this across practice solution, end-stage renal disease networks, QIN, QIO, et cetera, hospital chains, and so forth and so on. We solve our customers' needs through attention to detail. We do this through decades of market experience and, of course, our talented members here at Qsource that guide the way for your facilities. So in Tennessee, even though we have been based out of Tennessee for over 50 years, 51 to be exact, we still see that there is a continuation of a need, especially in our skilled nursing facilities. we are ever changing the survey background. CMS just released new updated versions for survey practices just yesterday. Just so you know, stay tuned. We'll have blogs directed as far as the four major areas of changes. So with that being said, when I first started in Tennessee, we had 316 facilities. Now we're just at 304. We've had several facilities that have had serious deficiencies in which they had to close, and that just disrupts not only the corporations as far as like budgeting, fines, etc. It also disrupts our staffing members having to go find new jobs, etc. Losing those great staff persons. But not only that, the most important thing is the residents that we serve. When we have closures, those residents have to go to another facility, and that is a disruption of their home. So we want to help facilities across the state to ensure that one, that their residents are well taken care of, that they have all the resources and guidance available to them to help succeed with the small portion of what we do in a day-to-day, which is our surveys. As you can tell, the average fine still in Tennessee is around $27,000, and that is related to serious deficiencies. And we're talking about immediate jeopardies above. That is a hefty fine. And a lot of times our facilities are not able to pay that. And then when you grow that, usually typically when we see this across states, it's not one immediate jeopardy facilities are cited, it's multiple at a time. So again, that's just the average fine. You can, accrue fines very fast, especially when it comes to multiple citations and the amount of time that you are out of compliance. So with that being said, that is why we decided to base this campaign to begin with in our home state, where we have been involved with facilities for so long and assisting with Medicare and Medicaid services. So some of the key services that we are going to talk about today are our SNF survey readiness, meaning that this is before you have a survey. This can go anywhere between clinical consulting on direct service areas, all the way up to providing mock surveys. And now I know that a lot of facilities and corporations do mock surveys within their own wheelhouse. But if you think about it, when you're doing that, you are taking your jobs are already busy. You're stopping other details in your day-to-day job to actually accomplish that. And sometimes you can be, because we love our facilities, we can be biased in that and not see the full picture of what's going on. That's why we love to do mock surveys, is because we're not biased. And as we see our surveys develop and our surveyors develop, we have noted, and there is a very considered pattern across the nation, is that when there used to be a pattern of events that caused a citation, that is no longer the case now. So there could be one area where you're out of compliance and you will not have a pattern with that surveyor, but they will go ahead and cite that citation. So that's why we love mock surveys, because it really opens your eye. We do come in and address like a natural survey would. So that way, one, your staff is prepared with questions. They are not nervous. Two, all of your paperwork and everything is in a row so that you present correctly to the state. You don't want them to wait around for certain items. And then also too, we're there looking, observing, and digging through your records to ensure that your compliance is there. If we see anything that's out of the way, et cetera, then it comes that we will help you fix that through a PIP, et cetera, a plan of correction, so that you already have that, it's copied, and you move on from it. The second part of this is our post-survey consulting. We have done a lot as far as this goes. it was that our mock survey services were one of our top services, but it has come, unfortunately, to our knowledge over the past year and a half that post-survey consulting and immediate jeopardy resolution has been two of our top key services nationwide. And when I say post-survey consulting, I'm talking about it encompasses everything. It can encompass education, directed plan of cares. We have assisted facilities with being on regional CMS calls, asking, petitioning for another chance. Any directed plan of care, again, that goes along with that if it goes up to the regional office. Delaying, any delays in those fines, trying to get that mitigated so that you are compliant and we stop that ability. So 2567, reviewing plan of correction writing, action of correction writing, and then not only that, post auditing for compliance, on-site and off-site auditing. It just depends on what the facility is wanting, setting up your survey books, etc. But then also, unfortunately, with that is immediate jeopardy resolution and abatement. This service for us has really, honestly, like tripled over the last year and a half because we're seeing that immediate jeopardies are cited more and more now. So when we do immediate jeopardy resolution, we are a part of your team. We are just an extension as a subject matter expert. We do all of the things that go along with immediate jeopardy. We've had facilities call us before they were even cited immediate jeopardy, and they felt like it was going to happen for someone to be on site as far as just an extra support on site with them when they were cited or weren't cited to help with filtering information to surveyors, etc. But then again, immediate writing of that plan of correction, because the goal when that is issued, it's already happened, unfortunately, but the goal that we want is we want that fine to stop for you. And that is what we do. We help write that action of removal, that abatement plan. We want that taken care of ASAP. We are there to help with education, getting all staff educated so you can be in compliance with that. But not only that, that is where we do not leave you, because we always know when things like this happen, there's always going to be a revisit. So we're there all the way through the process so that we make sure that we stay compliant, that we are asking those questions of your staff members, and that we do not know any other compliance issues related to the regulations. So SNF survey readiness. So again, just briefly going over this. Again, we do simulated surveys. We do this with using a software that is adapted to the surveyor software that surveyors have access to. And we go through every critical element pathway, every focus item, every resident observation. We truly do this like a survey. The only difference is that your team is guided through it. We ask these questions and we allow them to respond. Now, if it's not the best response that we're getting, then we're going to coach and counsel them through that. But that way, too, they understand that they can answer these questions and they're ready for it. And not just that, not be nervous, because a lot of times our staff members get so nervous and that's when they mess up. And we want them to be at ease as far as any part of the survey goes. That is anything with medication passes, any type of care being provided, all that. So we're ready to help with that. After we do this mock survey process, we always do an exit with the team. We have a preliminary idea of what citations would be identified. During this process, if at any point in time that we identify anything such as a harm tag or anything immediate jeopardy, you can say anything that is going to cause you any type of fines, etc., or go into an extended survey, we are going to immediately notify you, and we are going to help you correct it. We want to make sure before we leave off-site during this that all that is taken care of. It has already been ad hoc copied with your team. You already have a plan in place that goes along with your policies and procedures. Education has already started as far as that is concerned, just in case, because we all know that surveys are unannounced. We have an idea of when we will be surveyed, but that doesn't necessarily fall into place. And as changes occur with the survey process, we can see a lag time in the state office because they also are being trained and learning the new processes. So after the survey readiness report that we give you, which encompasses everything that we think that you could potentially be cited for, anything that we identified a pattern on, or we just identified once, you have this lovely report that you can take to QAPI and you can work through it. Not only that, whatever else you need from that, we can develop audit tools for you. We can assist you with adjusting policies and procedures if that is what you need. Directed education for individuals or groups of individuals so that you maintain compliance and mitigate the risk of any serious fines or citations. Again, we're here as experts to guide and support you. And we continue to follow you even after you've paid for this service. If you pay for this service and let's say 3 months down the road, you've not had survey, we still come back to you each month, ask how you're doing. There's anything that we can do for you as far as the report goes. Do you need a little bit more guidance in that report? Has something changed in the regulations since we've been there so we can readapt that with your report? And monitoring your compliance, because that is part of it. We do this big production of doing mock surveys in-house, etc., and we give all these recommendations, but that is where we lack a lot of the times, is that follow through and follow up. But we really bridge that gap for there. We don't want your team to slip. We don't want your building to slip, etc. We want to make sure that everybody is ready and they're focused for when that comes. So post-survey consulting is exactly what I said prior. We conduct comprehensive reports as far as your post-survey consulting goes, and it depends on, the time frame depends on what you're cited for. We have had 2567s, unfortunately, that have been 400 plus pages long that we have worked through. We've had facilities that have had, I think the most immediate jeopardies that we've worked on as this group together is 13, which is significant. And that is a lot for a facility to process. Not only was there 13 immediate jeopardies in that, but then after the immediate jeopardies, you still have a whole nother 2567 with all of your tags, right? After you've abated all your immediate jeopardies. So we're here. That is the most extensive that we have done. And I hope that no one on this call ever has to go through that, because that is a lot on your facility, your corporation, and your staff. Not only that, your residents. That really beats down a facility, but we are here to make sure that we stay upbeat and going. We can't change what happened, but we can move forward and we can move through. And that's what we do for you guys. That's why we're here. So we go through corrective action strategies, any kind of audit compliance, implementation, complete systems reviews. Because if you're, if this is happening and you have that extensive of a plan of correction, then we've got some systemic issues and we've got to fix them, because no one wants to lose a facility or a facility be put into denial of payment. And that's what we want to do. We want to mitigate that. We want to mitigate your fines. You want to mitigate your fines, right? We don't want you to accrue them. We want to stop them, but we also want to make sure when they come back, that for that next revisit, that you have no issues and your staff is ready, they are confident, and you are confident in them, that you are going to be compliant and you're not going to have any issues past that. So that's part of our post survey consulting. Really, honestly, the highest tags that we deal with in this section is really, harm tags, because immediate jeopardies has its own section, but still essentially it's the same thing. Like I said, this is our rapid response. You do not need us to just lollygag around, and neither do you. When you are issued immediate jeopardy, it should be an immediate response. And that's what we do. When we say rapid, if you need us to you, we get to you as soon as we can. We have not had an issue thus far when we've been deployed for these issues to be there within 24 to 48 hours. We have often, and I know Lindsay can attest to this, we have often boarded planes around 9 o'clock at night to get to you to help you, because we know this is the most critical point during that survey cycle for you, is to stop that CMP and to stop that accruing of that CMP. And everybody, usually when this happens, everybody has been in an extended survey for a certain amount of time. Typically, there's multiple surveyors on site. Everybody's there. Everybody's tired. Everybody's emotions are high. And it is just a breath of fresh air when you get a new face in to help take care of some of these critical element needs. And that's what our team does. We dive into those root causes of those citations with you, turn around developed action plans very, very fast. And our goal is to stabilize operations for you, not just with decreasing CMPs, but also the overtime that goes along with immediate jeopardy resolution or a 2567 completion, right? Because when you have stuff like this going on, the bigger parties sure are salary, but you have your floor nurses that are getting overtime, your CNAs that are getting overtime, your NDS coordinators, et cetera. Those key staff positions that are not salaried, they can also hit you as far as staffing goes and stabilizing those operations. So that's why we're here. We want to help complete this as fast as possible. Again, systems review, plan of correction development, immediate interventions, policy and procedure optimization. Like I said, we could change policies if we need to. We can adapt policies if we need to. And then not only that, to sustain compliance. It's great that you immediately resolve it and you stop the immediacy of the tag, right? So then you stop the CMP, hopefully. You stop that bleeding. We want to make sure that status post that you are sustaining, you are remaining compliance, and your auditing systems are in place for that. We have come across situations where, things happen and we go back out of a facility goes back out of compliance. But we're right there with you, to step you through that process. We are humans, and humans make errors. So it's not particularly one person's fault when this happens, but when our plans or your plans fail at that one point, because this is life and things do happen, we are right there again to start the process all over again to make sure we continue that compliance journey, just in case it does happen. Some of our additional services, infection control improvement. We do provide infection control assistance any type of competency-based training, as far as new DON training, new administrator training, MDS coordinators, anything like that. Just a person as far as a subject matter expert that can help them along the way, and just really honestly, really complement the persons that you already have in your corporations that do this on a day-to-day basis, right? Just to help out, because we all know that we super get busy and pulled in a lot of different directions. One of our biggest services that we do is QAPI program development. We really dive into QAPI. It is one of our passions. And we often, in some facilities, don't do it enough service as far as QAPI goes. It's usually fallen upon like the clinical department to work through QAPI, but that is not it. It's really an IDT approach. And all our programs really encompass that everybody is held accountable for their sections. And we develop that from whatever your policies and procedures are. We have our own, but if it's a corporation that we're doing a complete QAPI training on, which we have in the past, then we want to adopt that so that it mimics yours. And we make sure that we dissipate that information and that education in a streamlined manner. Risk management is another great tool that can help reduce hospital admissions, help take an extra look at your highly acute on chronic patients. A lot of times this ends up just the DON or the ADON doing this, and sometimes it can be a very big, it has all the potential to be a wonderful thing, but it falls short of what its goal is, because it's too time consuming. It's not organized. Nobody wants to meet again. Oh, we have to put a note in. We really streamline this process. We have a facility right now that we're actually working with on a 6-month. We do this on a 1-month contract, 3-month contract, 6-month contract, a year. It's whatever the facility's like. We're doing this on a 6-month contract right now to organize their at-risk management meetings and also perform the best practice documentation, because that's part of the risk management, not only identifying those residents at risk, but making sure that our nurses are documenting accurately and appropriately to support our MDS, and also any type of medications, et cetera, that those residents are on. And as you can see, if you've read the new survey update and guidelines, that's going to get even more stricter as we move along into 2025. We also do medical records reviews. This can be tailored to whatever you like. We honestly, we're experts on point click care, on Matrix. Those are the two that we have dealt with. We've dealt with WellSky. Really, honestly, it's help organizing your medical records. Is there things missing that you're overlooking? Are there things that you can do in your flow processes to make them more efficient? Are your nurses filling out their assessments accurately and thoroughly? Do you need education on that, et cetera? Do you have all the information to support any type of insurance review, NDS review, anything like that? And then there is NDS optimization. It doesn't just include financial benefit and reimbursement. That is one of our goals. But we've also had facilities that have been 3 to 5 months behind on MDSs, that they need help. They're drowning. That's a lot. That was the worst backlog that we've done. But we were able to get them caught up and back in compliance with their MDSs in a month's time. So that's always great. And not only that, from that, if there's a backlog, we need to catch that up. Our goal is 1, stabilization. 2 is to ensure sustainability. So teaching, training, organizing to make sure that this doesn't happen again. And not only that, the third is the financial benefit from it, to make sure that we are coding accurately MDSs to support any type of reimbursement, CMI, etc. That perfect snapshot of that resident to support their plan of care, what you're doing individually for that resident as well. So those are just some of our additional services. I'd like to take a moment to let you know about some of our client testimonies with some of our projects. This facility in particular had a high number of facility-acquired pressure ulcers, and then through working with them through our client, our client consulting / QAPI management, we were able to assist them with root cause analysis, appropriate training and interventions to help reduce this, right? So they were able to make their targeted goal in reductions of their facility-acquired pressure ulcers, which is a big deal for our residents. Next was staffing reduction. We often talk about how awful staffing turnover has been since the pandemic, and it has been. And it feels like at times it's slowing down, and then it will speed back up at times. It's really honestly just this roller coaster, it feels like. But our goal when we assist facilities in any type of consulting when it comes to staffing and staffing turnover to decrease is really really diving in to any type of satisfaction survey, really honestly trying to take the negative and turn it into a positive. So we want to work on turnover, but what I mean by that is we also want to understand why people stay and what's the good that we're doing that could be better, but what is really driving people away? It could be an individual. It could be an individual that just needs a little bit more education. It could be a systematic process. It could be our resident population, and we need a little bit more staff available just due to the our acute on chronic conditions. And does our CMI or our staffing grid support that? And how can we make sure that it does so that we can get the needs of our residents taken care of and honestly stop the turnover because we pay so much as far as corporations go for hiring on staff members just to have them turn around again. So again, stabilization of operations is one of the keys as far as turnover goes. This particular facility had an impressive 0% of turnover when we stopped, and I am so happy to say that this administrator we have spoken to here recently and is still does have a slight increase from 0 because 0 is very hard to maintain, but it is still nowhere close to 10.1. And I only want to say that it is about a 1.2 to a 2%. So honestly, it's really diving into key as far as your culture of your building goes. One of our next ones is also on fall rates percentage. We all know that falls always occur. But our goal with falls is really to mitigate as many as we can, and for those residents to have injuries. I had a really wise person tell me one time that each fall with a dementia patient ultimately can lead to death. It's a closer to death, and that's not what we want. And statistically, if you look at that, that is an accurate statement. If we have a resident that has dementia, that has fallen and sustained a major injury, it is an almost likely percentage, I think it's like around 90% or something like that they will not live 18 months past that injury because of the decline that it has on their body, especially if they're needing repair and they have to go underneath anesthesia. So when we work on falls with facilities, it is really important that we dive down deep and we break it apart. and we're not trying to say when we do this, we just completed one with the facility not long ago with this. And, it's an overwhelming report. They gave us 6 residents to review, and we had 15 pages worth of information just from that. And I'm not saying it's because they were doing wrong or anything like that. It is just we give an opportunity for a different root cause. We want you to look at the entire scene. And sometimes when we are in the midst of this and we are on a fight or flight mode, it is so hard to see the bigger picture and things. But not only that, we want to make sure that we have that documented for you guys, so that we can prove and help you prove, listen, I have this resident who falls all the time. I have really done everything that I could to mitigate this fall. It is related to their disease process, whatever that should be. And as a result of their disease process, these are the conditions that have occurred, gait imbalance, cognitive inability, dizziness. Do we know if they're dizzy? Probably not, because they have a BIM score of 3. They can't tell us when they're transitioning if they're dizzy or not, etc. And as a result of that, these medications that this patient is on are needed for day-to-day life so they can have some form of a quality of life. And that is what we do. We really try to summarize that up, so that you can show, per that Psalms, that you have done the best effort that you could to mitigate these falls, which we all know that we do on a day-to-day basis. Sometimes we just need a little bit of outside help to help guide that. So as you can see right here, here's just some of the examples of our case studies and guides that are available to you on our website. Please, we want you to if you haven't, please link up to our blogs. We have a lot of great information on our blogs, especially this immediate jeopardy preparation and remediation. This is a great example of some of the things that we can do. And again, we are working on blogging all the updates to the Psalms that were released yesterday or on Monday. Okay, hold on one second. Please, feel free to get started to contact with one of our experts. If you have something that you need, this is a free consultation for you guys. You can book by clicking on that, scanning your QR code right there on the screen. We are here to help you. We have people contact us all the time for resources. We want you guys to be deficiency free. We want you guys to have minimal citations. That's why we're here to help. That's what we're based upon. Again, you can also email me. My email's right there. Just to reference it, it's aodom@qsource.org. Anybody on this call, that is how our emails are always with Qsource. It is the first letter of our first name and our last name at qsource.org. Please feel free to reach out to any of us. We want you to have the resources that you need and the guidance that you need to help. One more thing that I'd like to mention that is specifically for Tennessee right now. A lot of facilities have participated with us in the past for our Culture of Safety Center initiative. This is a 3-year funded project that we are applying for again in the state of Tennessee, and it is through CMP funding, which means that it is free for you to participate. No, this is not a joke. It is free for you to participate because it is part of the CMP funding. What we do is we ask that you sign a letter of support, which you can sign up right here with, and we apply for this grant in the state of Tennessee. TDH let us know that they would be opening up the grant the week after Thanksgiving, and it will close before the end of December. So this is a really tight schedule for us, and we want you to apply. So we right now have 24 facilities that have signed up. We have one full corporation thank them so much. You know who you are if you're on the call, that has signed all of their facilities up to work this project. I can't tell you, it's really having subject matter experts at your fingertips. The goal of this project is to reduce fines and citations through quality development. We will take you through this 3-year project. We work on metrics that you individually need. So say for instance, if it's falls and falls with injury, we do that PIP project with you. We identify the root cause. We break down individual residents if we need to. If we have multiple root causes, we need to, right? It's to develop this program for you. And we take care of all the paperwork for you. Of course, you approve it, but we don't want that extra burden on you. We want you to be the advocates that you are for your residents and go out and implement those changes that are needed as far as intervention goes. So that's one of the focus areas we do is falls. We can do psychotropic medications, and anything. We really focus on anything to do with quality measures. And then the return on investment is that 1-year federal requirement for fulfilling a PIP project is completed. You have resources at your fingertips. You have subject matter experts, additional subject matter experts at your fingertips. And not only that, our goal in the end is for you to have an increase in that quality measure score, to see an increase in that, which is beneficial with our 5-star. So please sign up if you can. We would love for you to participate with us. We just closed our recruiting for this in the state of North Carolina and the state of Georgia, where we were recommended by the Tennessee Department of Health for expansion of this project in those 2 states because of the results that we had with this project. So please, if you can, sign up. We want to help you. We want to be here for you. All right. And we would just like for you guys, we just want you to know, thank you for joining us. We are here for you if you need us. Please do not hesitate to reach out to us if you need something. I had a facility just yesterday reach out to me about the new facility assessment. They were running behind on that facility assessment requirement that was due in August. And they're like, do you have a fillable form? Yes, we do. Let me send it to you so you can get it done really fast. Please, if you need something at all, please reach out to us. Book a free consultation. Let us help you. This is not expensive. Don't be worried about the expense of it. We are here. We will work with you and work around things. So we appreciate you again for your time, and we hope to speak to you soon. Thank you, guys. Any questions at all about the presentation that you have? If you don't feel comfortable asking a question on this, you are more than welcome to email me. I'm going to, again, put my email right here in the chat so that you have it. Kim and Lindsay, can you put yours in there too so they can have access to all of ours, just in case? And that way, if you guys want to email us one off, you're more than welcome to. We appreciate you so much for allowing us to be a part of your team. We've worked with many of you. Thank you, guys.